Hydroquinone in the Nu-Derm Sunfader Cream is used to lighten dark patches of skin caused by pregnancy, birth control pills, hormone medicine, or skin injury. It also contains sunscreens to prevent the spots from returning due to sunlight or ultraviolet light exposure. This medicine works by blocking the process in the skin that leads to discoloration. It is recommended to apply a thin layer of the cream to the affected area twice a day, in the morning and at night. Make sure to use sunscreen and protective clothing when going outside, as this cream can make your skin more sensitive to sunlight. When using Nu-Derm Sunfader Cream, it's important to conduct a patch test on a small area of unbroken skin first. Check for any serious side effects within 24 hours, such as itching, redness, puffiness, or blistering. If any of these symptoms occur, do not use the product and consult your doctor. If there is only mild redness, you may begin treatment with the cream. Apply the medication to the affected areas of the skin, as directed by your doctor, usually twice daily. It should only be used on the skin and should be kept away from the eyes, nose, and mouth. If it does come into contact with these areas, rinse with plenty of water. Nu-Derm Sunfader Cream may make the treated areas of skin more sensitive to the sun. It's important to avoid prolonged sun exposure, tanning booths, and sun lamps. When outdoors, wear protective clothing on the treated areas of the skin. While the cream contains a sunscreen, it should not be used as a sunscreen for other untreated skin. Instead, apply a separate sunscreen of SPF 15 or greater to your normal skin. Using the medication regularly is key to getting the most benefit from it. Try to use it at the same times each day to help you remember. If your condition persists or worsens after 2 months, be sure to inform your doctor. If you experience mild burning, stinging, redness, or dryness, it is important to speak with your doctor or pharmacist. Your doctor has determined that the benefits of using this medication outweigh the potential side effects for you. However, if you experience blistering, skin cracking, or darkening of the skin, stop using the product and contact your doctor immediately. While serious allergic reactions are rare, seek medical help if you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. If you experience any other effects, be sure to contact your doctor or pharmacist. Always consult with your doctor for medical advice about any potential side effects. Before using Nu-Derm Sunfader Cream, make sure to inform your doctor or pharmacist if you have any allergies to hydroquinone, sunscreens, or any other substances. This product may contain inactive ingredients that can cause allergic reactions, so it's important to discuss any concerns with your pharmacist. Additionally, be sure to inform your doctor or pharmacist about your medical history, especially if you have asthma or other skin conditions like eczema or psoriasis. If you are planning to have surgery, it's important to let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For pregnant women, Nu-Derm Sunfader Cream should only be used when clearly needed, so make sure to discuss the risks and benefits with your doctor. It is also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if the drug passes into breast milk. When using Nu-Derm Sunfader Cream, it is important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Before starting, stopping, or changing the dosage of any medicines, it's essential to seek approval from your doctor. This will help ensure the safe and effective use of Nu-Derm Sunfader Cream. If the Nu-Derm Sunfader Cream is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of an overdose may include shaking, tremors, and seizures. It's crucial to be cautious and keep this medication out of reach of children to prevent accidental ingestion. It's important not to share this medication with others. This cream has been prescribed specifically for your current skin condition, so it's not recommended to use it for any other skin problems unless directed by your doctor. If you have a different skin issue, your doctor may need to prescribe a different medication for that. If you forget to use Nu-Derm Sunfader Cream at the scheduled time, you can apply it as soon as you remember. However, if it's close to the time for your next dose, it's best to skip the missed dose and continue with the regular schedule. Avoid doubling up on doses to make up for the missed one. When storing Nu-Derm Sunfader Cream, make sure to keep it at room temperature and away from heat and light. It's important to keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to properly discard it when it is expired or no longer needed. If you have any questions about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.